Hi everyone, my name is Jasmine Flores, and today we're going to be talking about cat scratch disease. Cat scratch disease is caused by a bacteria known as Bartonella henselae, and it is a gram-negative rod. It is non-motile, it's an intracellular bacteria, and its main reservoir is domesticated cats, and humans are the host. One virulence factor that it has is a trimeric adhesion. They have outer membrane proteins, a headstock anchor structure, and three identical proteins. And it's this structure right here. It also resembles a lollipop-like structure, and it has bad A, which is known as Bartonella adhesion. And this ensures that there's a stable connection to the host cell for more bacteria-host cell interactions by the type 4 secretion system and the TWR system. This is the type 4 secretion system, and this is the TRW. And Bad A binds to the extracellular matrix, and during the assembly of the adhesions that are secreted, the membrane anchor forms a pore into the outer membrane, which is right here. And the head and stalk are transported through the pore onto the cell surface, and the C-terminal locks the pore, and this inhibits phagocytosis. FHA also helps with the adhesion and attachment. And the type 4 secretions, they help transport molecules to target cells. They transfer bacterial effector proteins or DNA to bacterial or eukaryotic cells. The system rearranges the actin cytoskeleton, and this triggers a pro-inflammatory response. And this is really important to inhibit apoptosis of endothelial cells. And the TRW, it's not really known very well, but they do believe that it is the most important part of the feline host interactions during the primary infection phase. And up here, you also have the BEPs, which are proteins that have been found to protect endothelial cells from apoptosis, and they do promote capillary sprouting, which go through the type 4 secretion system as well. The pathogenesis of this is that cats become infected with Bartonella henselae from flea bites, and this is because it enters their bloodstream and it can live there for months to years, and cats are completely asymptomatic. And then infected cats will then infect humans from a bite, scratch, or a lick. The bacteria is attached to epithelial cells from adhesion proteins and the type 4 secretions. And B. henselae is phagocytized by macrophages, but it does avoid destruction due to all its virulence factors. And then the bacteria is then transported to the lymph nodes of the infection site. So if you get bit on your right arm, the lymph that is closest on that limb or closest limb to the infection site will perform the lymph. And bacteria can leave the lymph and go onto the central nervous system, the heart, skin, or the bloodstream, and that is more common in the immune compromised. And this picture here just shows how fast it can replicate. It started from nothing to 30 minutes to 2 hours to 18 hours in a cell. And the infection period of this, the incubation period is 7 to 10 days. And they say that because that's how long it takes to get this little papule right here that you would see. And that is the site of the infection. And then, like I said before, the lymph, it goes closest to the infection site. And this is very common in veterinarians and younger children, usually under the age of 15. Some symptoms are rash, joint aches, loss of appetite, fatigue, swollen lymph, cyst, it bumps the papules, and the most common clinical diagnosis would be the swollen lymph, which is very painful, and it is huge, but it's not big enough to be bulbous, and the papules. There are complications that come with this, but it is more common in the immune compromised to have a complication with this disease. If that does happen, you could get bacillary angiomatosis, which is the proliferation of blood vessels, tumor-like masses in the skin and internal organs. And this is more common in HIV patients. I did read it can be in chemo patient in some transplant patients. And then you have bacillary paliosis, which is the hyperproliferation of capillaries in the liver, and they form large cysts filled with blood, and this could be fatal if not treated. And then you have endocarditis, which is the inflammation around the heart, making an infection on the valves, which would obviously cause joint aches, chest pain, and very, very heavy night sweats. And this is life threatening. Diagnosis, you can do a PCR test, a serological test, or a Starry stain. And this is the Starry stain, and it's a silver stain. And right here, you could see this is where the bacteria is growing. And the other picture I have is a biopsy. They usually do not take biopsy of lymph unless they do believe that it could be a tumor and they're trying to rule out one or the other. Treatment, this disease is actually self-limiting. It can last quite a while. It can go away from 2 weeks to 4 to 6 months. And for the immune compromised, if they start to have complications, they will get in antibiotics. Usually doxycycline is what I saw, and then I saw some erythromycin in some cases. And then you have prevention. Just make sure that you're washing your hands after playing or touching cats. Do not touch stray cats. Keep your cats indoors, protect them from fleas, check them periodically. And they do say that if you are going to get a cat, to make sure that you adopt a cat that is a year or 1 year or older, and that is especially for the immune compromised to prevent any of this.